Hey everyone, welcome back for another deep dive. Those times when you really need to get a handle on something complex kind of quickly. Well, that's what we're doing today with cardiac tamponade.
Yeah.
You sent over some dense medical research on it, and we're here to break it down. So first things first, what exactly is cardiac tamponade?
Picture this.
Hmm.
Your heart, working away tirelessly, is tucked safely in a sac called the pericardium.
Right.
And there's normally just this tiny bit of fluid in there, just enough to let things move smoothly. But with cardiac tamponade, that fluid starts building up and it starts squeezing the heart.
Yeah.
Imagine a water balloon being squeezed. That's the kind of pressure we're talking about.
Right.
And it can become life-threatening pretty quickly.
Yeah, absolutely.
Now, you might think this is some rare, obscure condition, but that's where things get interesting. It's actually more common than you'd expect. What's fascinating is that it doesn't always take a massive amount of fluid to cause a real problem. Sometimes it's just that little bit, that last drop, that really tips the scales. And that's why early detection is so important.
The research mentions a U.S. study, and they found cardiac tamponade in 0.05% of emergency admissions.
Okay.
Now, that might sound like a tiny number, but it translates to thousands of cases every single year.
Wow.
And here's another thing. The causes are all over the map. We're talking infections, cancer, even complications from medical procedures. It's not just one thing.
And that's why understanding this condition is so crucial, because it can be triggered by so many things. We have to keep it in mind across a whole range of medical situations. It's not just a standalone issue.
So how do we play medical detective and catch this early on? The research points to some telltale signs and symptoms, but they can be subtle, right?
Right.
We're talking about things like shortness of breath, especially when you're lying down, weakness, a rapid heartbeat, even decreased urine output.
Yeah, it can be tricky.
And then there's this thing called Beck's triad.
Right.
Low blood pressure, distended neck veins, and muffled heart. Sounds classic, right?
It does, doesn't it? But here's the thing, that classic triad, it's not as reliable as we once thought.
Really?
The research shows it actually misses a lot of cases. So while it's good to be aware of, we can't rely on it solely. This really brings home the need for maintaining a high index of suspicion and, even more importantly, using accurate diagnostic tools.
And when it comes to diagnostics, there's one clear winner: echocardiography.
Echocardiography.
Think of it as a live feed of your heart, showing us exactly what's happening within that pericardium.
And it's not just about the visuals either. Echocardiography can detect even tiny amounts of that excess fluid. It can actually visualize the compression on the heart and track changes in blood flow. It even helps us differentiate cardiac tamponade from other conditions that might look very similar.
So we've got a way to get a clear picture.
Yes.
Which is reassuring. But the big question is, how do we treat it? The research is crystal clear on this one. The only effective treatment is to relieve that pressure on the heart, and quickly.
Absolutely. Time is of the essence.
So there are two main approaches they talk about: pericardiocentesis and surgery. Pericardiocentesis is the less invasive option. They basically use a needle to drain that excess fluid, often guided by imaging for precision.
Like a guided missile.
Exactly. And then there's surgery, which is usually reserved for more, I guess, complex situations where they actually create what's called a pericardial window.
Right.
So they're essentially removing a small part of that pericardium to prevent future fluid buildup.
So the choice between those two isn't always straightforward. It depends on things like, well, obviously, the severity of the tamponade, the underlying cause, the patient's overall health, other individual factors all come into play.
It's not a one-size-fits-all situation.
Exactly. Every case is unique.
Which just makes sense with the heart. Now, this next part, and this is really interesting. The research talks about some cutting-edge stuff, new developments in how we approach the immune system's inflammatory response in cardiac tamponade.
Okay, yeah, they talk about that.
They mentioned something called, and I'm probably going to say this wrong, the NLRP3 inflammasome.
NLRP3 inflammasome, that's it.
But they don't really go too deep into it.
Yeah, so think of the NLRP3 inflammasome. It's like an alarm system, right? So in your body, when it senses danger, like inflammation, it sets off this whole cascade of responses.
Interesting.
What's really cool is researchers think that by targeting this alarm system directly, we could have a whole new way to treat cardiac tamponade, especially in cases where inflammation is a key driver.
So instead of just treating the fluid buildup, we might be able to hit it off at the pass.
Exactly. It's a game changer. And this brings us to a really interesting question the research brings up. the ethics of treating large pericardial effusions when there aren't any noticeable symptoms.
Oh, that's a tough one.
It is, isn't it?
Like, do you fix a small crack in your windshield now or wait and see if it becomes a bigger problem?
Exactly. You're weighing potential benefits against the risks of maybe doing a procedure that wasn't absolutely necessary. There's no easy answer.
It's a balance.
Yeah, it's something doctors and researchers are constantly thinking about, discussing. It highlights how complex these decisions can be.
It really does.
And it shows how important that open communication between a doctor and a patient is, right?
Okay.
Making sure treatment decisions are made together, thinking about individual circumstances.
Now let's dive into some of the numbers they give about cardiac tamponade. It's kind of surprising how often it's connected to other conditions.
Yeah, like cancer, for example.
Exactly, cancer.
That's a significant one.
It is.
In developed countries, cancer is a leading cause of cardiac tamponade. Now, we don't have exact numbers on how often it happens, and it's not just one type of cancer either. We see it with lung cancer, breast cancer, blood cancers like leukemia, lymphoma. It's a long list.
Yeah, it really shows how interconnected everything is in our bodies.
Absolutely. And the research doesn't just say, oh, cancer can cause this. It goes deeper, like how cancer treatments, chemo, radiation, those can sometimes lead to complications with the pericardium.
They mentioned some interesting studies. One looked at over a million
Mm-hmm.
lung cancer patients, and they found that those who had radiation therapy were at a higher risk of developing cardiac tamponade.
Right. And there's another study that looked at patients who had pericardiocentesis for pericardial effusion. Turns out a good chunk of those patients had undergone chemo in the year before the procedure.
It's a tough balance, trying to treat one serious illness while trying to avoid other potential issues.
You got it. And it shows why careful monitoring is so important and a proactive approach. Catching it early is key.
Speaking of other causes, autoimmune diseases come up too, especially lupus.
Yeah, and the numbers there are pretty striking.
Yeah.
One study, they found that more than 16%, over 16% of lupus patients had pericardial effusion. Now, not all of them developed tamponade, but just having the effusion was linked to a higher risk of dying.
Another piece of the puzzle.
Right. It really goes beyond just the heart itself.
For sure. Now, this one might seem a little out of left field, but the research talks about uremic pericarditis.
Okay, and this is specifically in people with kidney problems, right?
Exactly. Fascinating, but also a little concerning.
What's unique about uremic pericarditis is it really only pops up in folks with kidney disease.
Yeah.
And it can happen before they even start dialysis or within those first 8 weeks of starting. The research says it often comes down to waste products building up in the blood, since the kidneys aren't doing their job filtering.
And that buildup then causes problems in the pericardium.
Bingo. Increases the risk of cardiac tamponade.
They had a really surprising stat on this.
Yeah. Let's hear it.
Studies show that in patients with end-stage renal disease, where the kidneys are failing, asymptomatic pericardial effusion is really common, like scary common.
How common are we talking?
As high as 70 to 100%.
Yeah. Wow.
Yeah, that stopped me in my tracks too.
It really drives home the point that this isn't just about the heart, is it? It's connected to so many other systems.
Okay, shifting gears a bit, the research mentions something called pectus excavatum.
Pectus excavatum. Okay, so we're talking about that condition where the chest kind of caves inward.
Exactly. You wouldn't think it'd be related to cardiac tamponade.
No, not at first glance.
But they found this study, and it showed that people with pectus excavatum were much more likely to have pericardial effusion than those without it.
Interesting. How much more likely?
Over 13% of the pectus excavatum group had it, compared to less than 2% of the control group.
That's a pretty big jump.
Right. So while most of those effusions weren't super serious, it's still a weird connection. Another reminder that the body is full of surprises.
For sure. Medicine is like one big detective story sometimes.
Totally. So circling back to treatment for a sec, the research is very clear. When cardiac tamponade hits, you got to get that fluid drained fast.
Absolutely. It's life-saving.
But they also say that the decision to drain and how they do it, it depends.
Right. It's not one size fits all. What does it depend on?
A bunch of things. How bad the symptoms are, what caused the tamponade, the imaging result is, it's complicated.
So how do they make that call?
They actually have this, triage strategy.
Yeah.
A checklist of factors to help doctors decide how urgent it is to drain the fluid.
Okay, that makes sense.
Like, if someone has a malignant effusion and their blood pressure is tanking, that's going to get bumped to the front of the line.
For sure, time is critical in those situations.
Now, we've talked about pericardiocentesis and surgery, but let's get into the nitty-gritty of each one.
Okay, good idea.
So pericardiocentesis is that needle drainage thing we
All
mentioned.
right, less invasive.
They go into a lot of detail about the different techniques and how important it is to use imaging guidance. Like, they really stress that.
And that makes sense, right? You want to be as precise as possible when you're sticking a needle near the heart.
Exactly. And not just one type of imaging either. They talk about combining echocardiography with fluoroscopy, especially if the effusion is in these weird pockets.
You've got a really clear picture.
Yep. And those imaging tools aren't just for guiding the needle, they're also used to monitor the patient during and after the procedure.
Makes sense. Got to make sure everything's going smoothly. So what about complications? Any risks with pericardiocentesis?
Well, yeah, I mean, anytime you're talking about sticking a needle into someone's chest, there are going to be some risks.
Right.
And the research is very upfront about that.
Ed.
They say the most serious ones are accidentally puncturing the heart, blood vessels, lungs, organs in the abdomen.
That's a pretty scary list.
Yeah. And then there's the risk of bleeding, infection, even the heart rate slowing down dangerously.
So when they're considering pericardiocentesis, what factors make those complications more likely?
Well, the big one is the experience of the doctor doing the procedure.
That makes sense. Practice makes perfect, as they say.
Exactly. And using imaging guidance throughout, like we talked about.
So for someone who might be facing this procedure, it sounds like finding an experienced doctor and making sure they're using the right imaging is key.
Absolutely.
So with surgery, it's usually the backup plan when using a needle just isn't cutting it. Like, say the fluid is trapped in little pockets, or if the tamponade is from bleeding that they can't stop any other way.
So it's like we tried the less invasive thing, time to bring in the big guns.
Yeah, something like that. The research talks about this thing called a pericardial window. Basically, they take out a tiny piece of the pericardium itself so the fluid can drain out and won't door up again.
This window thing, are there different ways to do it?
There are. They mentioned doing it the old-fashioned way with a big incision, or they can do it through tiny cuts, like laparoscopic surgery using cameras and stuff.
Sounds pretty high tech.
It is. I guess which way they go depends on how healthy the patient is, where that effusion is, and who's doing the surgery, their experience.
Makes sense. So somebody's had one of these drainage things done. What's recovery like?
Well, it depends, right? Pericardiocentesis, that needle thing, usually you go home the same day.
In and out.
Exactly. Might be a little sore, take it easy for a bit, but back to normal pretty quick. Surgery, on the other hand, that's a whole different ballgame.
Yeah, gotta be longer, right?
Oh, yeah. Pericardial window, you're probably in the hospital for a few days, full recovery, maybe even a few weeks. And you can't just jump back into things. Gotta take it slow, do what the doctor says.
Important stuff. So we've talked about treating it. What about stopping it before it even starts? Can you do that?
Well, you can't prevent every case, but there are things you can do to lower your chances, like avoiding infections, especially those nasty bacterial ones like tuberculosis that can lead to pericarditis.
So basic hygiene, being careful around sick people, that kind of thing.
Exactly. And staying on top of any other health problems you've got, like if you have lupus or thyroid issues, managing those is key. Oh, and getting those vaccinations, flu shot, all that good stuff.
Keeping those defenses up.
Yes. And it's not just about dodging the initial infection either. If you start getting chest pain, fever, shortness of breath stuff that could be pericarditis, get to a doctor ASAP. Treating that early can often stop it from turning into tamponade.
The early bird catches the worm, as they say.
Something like that.
One thing that struck me in all this research was how it talked about quality of life. We don't always think about that side of things with medical stuff.
True, but it's huge. Cardiac tamponade, by its very nature, it's serious, right? Those symptoms, struggling to breathe, feeling weak and tired all the time, that can make everyday life really hard.
Just getting through the day becomes a challenge.
Exactly. And then there's the mental toll, The anxiety of dealing with something life-threatening, it wears on you.
Absolutely. And if it's caused by something else that's already hard to deal with, like cancer or a chronic illness, that just adds another layer.
Right. It's a lot to handle. The research did mention, though, that for a lot of folks, if the root cause is treatable, they can bounce back pretty well, get back to a good quality of life. But they also said that for some people, especially those dealing with malignant effusions or really bad heart inflammation, the outlook isn't as good.
That's got to be really tough.
It is, and that's where having a good support system is so important, both from the medical side, managing their symptoms, but also emotionally, helping them cope with the stress, stay as independent as possible, just making sure they're not alone in this.
So important.
Yeah.
It sounds like there's a lot more to treating this than just the medical procedures.
Oh, for sure. Actually, the research even mentioned cardiac rehab as a way to help people recover, especially after surgery.
Oh, interesting. Like getting back in shape after all that.
Yeah, they have these programs, help you rebuild strength, stamina, that kind of thing.
Wow. So they're not just fixing the immediate problem, they're setting you up for success down the road too.
Exactly, it's all connected.
We've covered a ton of info today. Any final thoughts for our listeners, key things to take away from all this?
Well, first off, cardiac tamponade is serious business. You need to get help immediately. Early detection is key. We've talked about the symptoms, but remember, they can be sneaky, so if something feels off, go get checked out.
Better safe than sorry, right?
Not always.
No.
And that echocardiography thing we talked about, that's your best bet for getting a diagnosis. It lets the doctors actually see what's going on in there.
It's like having X-ray vision, but for your heart.
Exactly. And once they figure out what's going on, they'll decide on the best way to drain that fluid, whether it's with a needle or surgery.
Right. And even though you can't prevent every case, there's a lot you can do to lower your risk. Like we talked about, taking care of your health, watching out for infections, getting the right treatment if you need it.
And don't forget about that quality of life piece. Having a good support system makes a world of difference.
Absolutely. Well, there you have it, folks. A deep dive into cardiac tamponade. We've gone through what causes it, how it shows up, how it's treated, and even some of the latest research.
And we've talked about how being proactive with your health, catching things early, and having good support can really improve your outcome.
We'll be sure to put some more info in the show notes for anyone who wants to dig a little deeper. Until next time, stay curious.